Sorry for the delay, ladies and gentlemen. Now I'd like to call upon the second speaker of the government to present the case. Time given is 5 minutes.
Good morning to my dear opponents, adjudicators, and the members of the class. I am Shani, the second speaker of the government team. Our topic today is parents should be allowed to choose the baby's gender. We, the government team, strongly agree with today's topic. Before I start my rebuttal, I would like to emphasize that this is a situation that has existed. So, my dear opponent, you should show evidence to prove that this gender selection technology is so deadly, harmful, and dangerous that it should be banned. For instance, cigarettes and drugs are banned. Why? Because they will harm human lives. Thus, I would like to emphasize again, the burden of proof for today is at the opposition. Now, to my rebuttal, the first speaker of opposition team has tried to say about gender imbalance. But this is just your own opinion. My dear opponent, do you have any evidence to prove that the problem of gender stereotype might become worse if parents are allowed to choose their baby's genders? No, you don't. Now, I will say again, the opposite team is concerned about the gender problem, which are boys will increase and girls will decrease, but we concerned about human lives, which are disease, which will kill people, abortion, and abandonment, which are more important. I am sure that our vice adjudicator will know about it. At the side of government, we concerned about human lives. I think that nothing is more important than human lives, certainly include the point of opposition first speaker. Thus, why should no parents be allowed in these cases? Now, I will bring out our team's second and third points. To my first point, parents should be allowed to choose their baby's gender to reduce the cases of sex-selective abortion. Sex-selective abortion is a practice of terminating a pregnancy based upon the predicted sex of the infant. If the child is the desired gender of the parents, there will definitely be a lot loss of sex-selective abortions. Everyone can agree that this is a terrible waste of life, and of course, many people strongly object to abortion on moral grounds. Thus, the use of gender selection technology will reduce the cases of sex-selective abortion. Of course, in the cases of parents' responsibility, parents should raise and care their own children no matter the gender is boy or girl. But undeniably, there are many irresponsible and selfish parents in the world today. They will choose to abort the innocent baby instead of loving and caring them, no matter boy or girl, and the child who will suffer. What I try to say is even education and law can't really stop the action of sex-selective abortion. The best way is to treat the problem from its roots, which is reduce the situation of gender of parents giving birth to an undesired gender baby. In this situation, we are trying our very best to reduce this problem. I repeat, we, the government team, are trying our very best to reduce this problem. And to my second point, parents should be allowed to choose their baby's gender in the point of family balancing. Let me elaborate it. Many parents may have born to several children of the same gender and they badly want their next child to be the opposite sex. Most of them will give birth to until a child with the desired gender is born. In this case, multiple pregnancy situations will occur and lead to more problems such as overpopulation or insufficient social resources. What I try to say is, if parents are able to use the technology to give birth to the baby with the desired gender, they don't need to give birth to 4 or 5 children only to reach the family balancing. This is not a particular cases, but a majority. Michael Chapman, the president of Fertility Society of Australia, has said that in 1 year, there are almost 500 couples with 3 or 4 children of the same sex want to have a child of the opposite sex. And I would emphasize that this point is not discriminate any gender. We are just discussing about family balancing, which is the parents hope to have both boy and girl babies. And that's my talk for all today. Thank you.
Thank you, Ms. Shani Lee. The second speaker of the government team has spoken for 3 minutes and 57 seconds. Next, I would like to call upon the second speaker of the opposition team to present his case. Time given is 5 minutes. Please begin.
Good afternoon to the honorable educators, respectable timekeeper, and chairman, members of the floor, and also my opponents. I am Jun Xian, the second speaker of the opposition team, and we strongly oppose to the motion today, which is parents should be allowed to choose their child's gender. First, I will be giving out the rebuttals towards the government team, and also give out my team's second point, which is gender stereotypes, and also the expectation of the child's family, and third point, which is the risk of IVF. First of all, the first speaker said that we should find a better way to reduce the hereditary diseases. And there is actually a way using CRISPR. A gene, an RNA sequence called Cas9 has been used in the past to carry out genetic such editing, like changing the wheat that we eat every day.
BOI, please. Please talk more clearly. It's saying that we do not understand the point that give up from you.
Okay. As you
Thank
know,
you.
humans are made out of genes, which makes us different. And Cas9 can precisely cut out the genes and switch out them with the genes that we want. And for wheat, as an example, in the past, wheat has been known to die out during droughts or even heavy floods. But with Cas9, they switched out the genes, the user's genes, for a more weather-resistant genes. Now to my point. One of the most difficult problems in our society is gender discrimination, in which China and India are being one of, if not the worst. By allowing them to have control over their child's gender, we will be indirectly giving them the freedom to do whatever they want. By doing so, they can have their child. And that's happy ending, right? No. By doing so, they will not only get what they want, but they will push the child further for their own needs. And also worsen gender discrimination. The given reason that most parents want to choose their gender of the child is due to the different traits and behaviors associated with that gender, and correlating to the fact the child will be used as an instrument to complete their stereotypical goals. Best example being India, which is still infamous for the majority of the population still believing that women are a lesser race. By giving developing countries who are gender biased, like India, the freedom to choose the child's gender, the majority will choose to have a male child, which further states that it worsens the gender imbalance in the world.
BOI, please.
Reject. And moving on to my team's third point, which is IVF, which is the risk that IVF brings. By doing the fertilization artificially, there's no doubt that there will be a lot of problems that are brought up with it. Some of which includes severe health issues, ectopic pregnancy, and also the mutation of genes. The embryo, the mutation of genes of the embryo. Yeah.
Gender equality education is still in society. As example, the proportion of women political is slowly rising. So, can you prove that this is also gender inequality in this society today?
I will leave it to my third speaker to answer to it.
Thank you.
Okay. Yeah. With IVF, the dosage recommended for with IVF, they have to use a fertility drug that is injected into the ovary, which is used to nourish the embryo. And we actually have it, and mothers actually produce it themselves naturally if the procedure was done naturally. But with IVF, the dosage recommended for each person is different, leading to severe abdominal pains due to swelling of the ovaries. And the worst cases leads to rapid weight gain and also shortness of breath. Next off is ectopic pregnancy, which is also the same as late fertilization, which the embryo falls out of the uterus, which isn't quite severe, but consider this, the cheapest price of this operation is $57K in US dollars. I can list it out, but that's too much. But last but not least is the mutations. As this technology is still in its lab testing stages, there will be numerous unpredictable mutations that will happen in this procedure. And although this technology is in its beta stages, companies will try to push this technology out for profits. and I raise my case.
Thank you, Mr. Chun Xian. The second speaker of the opposition team has spoken for 5 minutes and 6 seconds. Next, I'd like to call upon the third speaker of the government team to present a case. Time given is 5 minutes. Please begin.
Thank you, Chairperson and Timekeeper. Good afternoon to the respected adjudicator, judges, members of the floor, and my worthy opponents. I, Jo Yu-Hong, the third speaker of the government team. I'm hereby rebut the problematic point of view from opposition team. Before doing the rebuttals, I would like to emphasize our premise of today. The first premise is the original aim of the invention of gender selection technology is to save life. And the second premise is we are defending the human right, which is freedom of choice. If these two premises are agreed, therefore you should accept that this technology is not deadly harmful for us. Now I will start my rebuttals. The first speaker of the opposition team has stated that gender imbalance. Eckhard Dahl, a bioethics at the University of Gießen in Germany, spoke at an international human reproduction seminar hosted by the Royal Society in London, stating that research shows that countries with the most advanced gender selection technologies, such as United States, Germany, and the United Kingdom, no gender preference were found. Besides, the most people want a second child with a different gender than the first child. Therefore, Professor Dahl argues that there is no evidence to prove that there is a danger of an imbalance in the gender ratio in the West. For the developing country or even backward country, their mind can be changed by education. We need education to solve the problem of gender imbalance or even gender inequality, but not solved by forbidding the gender selection technology. And secondly, the second speaker of the opposition team has stated that gender inequality. This technology, the first speaker of the opposition team has also stated that this technology is unnecessary, but this technology is actually useful. It is because this technology can reduce the rates of abortion, child abandonment, and infanticide. Besides, gender selection for sex-linked disease prevention is well established and not controversial. Thus, this technology is advanced and useful to improve the problems. And for the second speaker of the opposition team has stated that gender inequality. This is just your own opinion, my dear opponent. Do you have any evidence to prove that the problem of gender stereotype must become worse if parents are allowed to choose their baby's gender? Besides, gender equality education is instilling in society. This concept is applicated in society. Therefore, women's right to be educated has been significantly improved, and more women have put forward higher expectations and pursuits for their career developing according to our research on Shihua Daily. In other words, when children grow up, they will break gender stereotype because of the right education. And for the third point of the opposition team, they have said that gender selection technology is risky, but for the second point of the opposition team, For the second point of the opposition team, I can deny that gender biasness concept is still occur, but the society is progressing. Gender equality concept is becoming more acceptable and applicated by the society today. According to our research, the Women's Political Participation Map 2019, jointly received by UN Women and the Interparliamentary Union today, shows that the proportion of women in political decision making is slowly rising. At present, the proportion of women ministers worldwide has reached 20.7%, a record high, an increase of 2.4 percentage points compared to 2017. And the number of sectors headed by women is also increasing. For instance, the President of Taiwan, Ms. Tsai Ing-wen, and the Vice Minister of Malaysia, which is Wan Azizah. And for the third point of the opposition team, which is the gender selection technology is risky, every operation has some risk. For instance, chemotherapy, which is used to treat cancer, it may cause nausea, vomiting, diarrhea, hair loss, even liver and kidney damage. For myopic laser surgery, it can cure myopia, but it will decrease the eye immunity, cause infection, dry eye, photophobia, and etc. The cosmetic surgery, it takes higher risk
which are complications related to anesthesia, including pneumonia, blood clots, and rarely death, infection at the incision site, which may worsen scarring and require additional surgery. However, these medical procedures are not prohibited. These technologies are allowed to be exist, and use it or not is depend on the parent's decision. Therefore, thank you, and I'm strongly agree to the motion, which is parents should be allowed to choose their baby's gender. Thank you.
Thank you, Ms. Lee-Hong. The third speaker of the government team has spoken for 5 minutes and 10 seconds. Now, I will call upon the third speaker of the opposition team to give the speech.
Very good afternoon to the honorable educators, respectable chairman and timekeepers, members of the floor, and of course my boarding opponents. I'm Zoe, the third speaker of the opposition team, and we strongly oppose to the motion today, which is parents should be allowed to choose their baby's gender. And as the third speaker, I will be giving out rebuttals towards the government team and strengthen my team's case, and prove to you once and for all that this motion should fall. Now, moving on to my rebuttals towards the government team. The first speaker has talked about how this treatment could reduce the rates of hereditary disease. But like my first speaker has mentioned, a study carried at Massachusetts Infertility Clinic shows that the majority of couples that use these techniques are purely influenced by social stereotypes. Side government, our first point is that this treatment can cause gender imbalance and that it could lead to major conflict and violence. Are you going to risk all that just to solve the small problem that you have? And the first speaker of the government team also asked for an alternative way. And members of the floor, why the burden of proof is on side government is that we are debating whether if the government's proposal should be accepted. We are not arguing for a solution. Side government is supposed to prove that this treatment outweighs the cons, which my team has already mentioned. But like I said earlier, are you going to risk that just to solve a smaller problem? The second speaker rejected. The second speaker of the government team has mentioned of how it could solve sex-selective abortion. Members of the floor, sex-selective abortions happens more in developing countries which are heavily influenced by gender stereotypes. And studies have shown that countries that have high levels of gender inequalities do correlate to high levels of poverty. And the majority of these parents do not have the money to pay for the costly amount of this treatment. And the third speaker has mentioned of how there is not a problem of gender discrimination in the West. But according to what my first speaker has said, I will be stating that when I restate my team's case. Now I'll be restating my first speaker's case. So what my first speaker has mentioned is if this technology is allowed, gender imbalance would happen, and she has proven that with statistics. This is already happening in the world, ladies and gentlemen. If we allow this technology, there will be absolutely no doubt it would worsen the issue. In China and India, which together accounts for more than 40% of the entire world's population, there were 130 men for every 100 women. And what does gender imbalance cause? More violence. Why? In India, a study carried out at around 30 to 40 years ago showed a strong correlation between homicide and violent rates in individual states across the country and the sex ratio in those states. And moving on to our team's second point. My second speaker has mentioned how if parents were allowed to choose the baby's gender, it is definitively submitting to stereotypes and making a child a victim of high expectations from their family. Members of the floor, in countries where gender discrimination is more of a problem, families are more likely to follow gender stereotypes. Because of these stereotypes, they will accordingly choose a gender which is more ideal to their liking. But members of the floor, you are putting your child in a situation on a road that they did not decide whether. Yes.
This is just your opinion. This is just your opinion. Do you have any evidence to prove that the problem of gender stereotypes
We have proven that gender stereotypes do happen in these countries. Okay, moving on. Because of these stereotypes, you're putting your child on a road that did not decide whether if they want to be arm in arm. You're making them, even worse, programming them to be exactly how you want them to be. Dear judges, to do that and to use for their own good as an excuse is absolutely despicable.
Please.
Rejected. You are treating them as tools because you are neglecting their right to choose their future in your own favor, and that can cause a lot of problems. Now, moving on to our team's third point. The government might be telling you how many chances of diseases that could be reduced, of how flawless the treatment could be. My second speaker has already mentioned the risk of this treatment, which is called IVF and GDP, and treatment to both mother and child. To add on to that, between 1991 and 2010, the British have done a study on 250,000 women that are IVF patients. And although they found no increased risk in breast cancer or uterine cancer, results have shown that women that are IVF patients are likely to develop ovarian cancer. Ladies and gentlemen, even though there are people who can afford this treatment, so ladies and gentlemen, let me ask you this. Is this treatment really, really necessary? And that we urge the members of the floor to sway with us in saying that this motion should fall. Proud to oppose.
Thank you, Mr. Lee. The first speaker has spoken for 5 minutes and 16 seconds. So now the first, second, and third speaker from the government and the opposition team have delivered their speeches. Before both teams deliver the reply speeches, each team will be given 2 minutes to discuss. The time starts now. Alright, discussion time is up. Here are the rules for reply speech. After the speaker has spoken for 3 minutes, the bell will ring like this. And after the speaker has spoken for 4 minutes, the bell will ring twice. The speaker will have to stop. Now, it's time for the reply speech. I'll now invite the reply speaker of the opposition team to present this reply speech. Time given is 4 minutes. Please begin.
Thank you, timekeepers and the chairperson. A very good afternoon to the honorable adjudicators, vice chairman, timekeepers, members of the floor, and of course my dear worthy opponent. So, as the fourth speaker, I, Junqi, the reply speaker of the opposition team, will be summarizing the whole debate and talk about the main clashes that is happening in this debate. So, let us start with the main clashes in this debate, which is the allowance of sex selection technology. So, the government team has given 3 main advantages, which is sex selection technology can be an alternative way to prevent hereditary disease. The second point is to reduce the chances of sex abortion. And finally, the third point for the government team is for family balancing. Whereas the opposition team, which is my team, has denied the fact and also given 3 main consequences, which is sex selection technology can cause gender imbalance. The second one is it will worsen the situation of gender discrimination in the stereotypes society. And the third point is it does bring certain risks in IVF procedure. So what I think this whole debate is both sides of the team did remarkably well. But I have to give credit that the government team has given numerous POIs and we are not able to think very fast and clearly. But I still think that our team did much more better. Let's compare with some points that our team had given and the government team. So by comparison, let's compare with the worst case scenario of the government's proposal. So like what all my previous speakers have said, it can cause gender imbalance, which can cause conflicts between gender. And the second thing is it will worsen the gender discrimination in the developing countries, which is, for example, like India or China. And it can even bring risk to the people who choose IVF. So as for our team, the worst case scenario is nothing would happen. If this so-called sex selection technology can be banned, then the problem for gender discrimination will not be worsened, and the problems for the gender imbalance will also not be worsened. And of course, those risks for the IVF procedure will also not happen. And as my team has already stated that the government team has said that this so-called IVF procedure can prevent genetical disease that comes from your parents as the carrier, but our team, the opposition team, has also proven that IVF does prevent genetical disease, but in the end, it also carries some disease after we have born, like in the future generation. So dear judges, our scenario is clearly better than the government. So before finishing my speech, I urge the judges to sway with the opposition team once again, as we strongly oppose today's topics, which is parents should choose their baby's gender. Thank you. Gender. Sorry.
Thank you, Ms. Junqi, and the opposition reply speaker has spoken for 3 minutes and 26 seconds. So now I would like to invite the government reply speaker to give her speech.
Thank you, Chairman and timekeeper. A very good afternoon to the adjudicators, members of the floor, and my fellow opponents. I'm Lian, and I'm the fourth speaker of the government team. The topic of our debate today is parents should be allowed to choose their baby's gender. We, the government team, strongly believe that this statement is true. Now, it is the time to wrap up our debate and introduce some main clashes that went on during this debate. However, due to the limited time, I would like to elaborate deeply on one main clash rather than superficially state several clashes. The main and most important clash in this debate is that whether gender selection benefits only the parents or both parties. So, our team has given 3 main points, which is genetic disorder, family balancing, and sex-related abortion. And the opposition team has also given 3 main points, which is gender imbalance, gender inequality, and the gender selection technology is risky. But according to our team's rebuttal, have proved that their problems can be solved. Next, I would like to speak out about the comparison between the best case scenario and the worst case scenario between our 2 teams. As the government team, the best case scenario of our topic today is that if we allow parents to choose their baby's gender, it will bring more happiness to families. Besides that, it will fulfill our human rights, which is freedom to choose. In contrast, for the opposition team, their best case is every parent will happy and satisfied with any gender of baby, just by miracle. I would like to repeat, just by miracle. So, I would like to emphasize that compared to the opposition team, the best case of our team is more realistic, freedom, and beneficial. Next, for the worst case scenario for our team is that the case of gender